Hi, welcome to Autism ABCs. I'm Dr. Lynette Louise, otherwise known as the Brain Broad. And today we are going to do the letter J. Okay, J, when it comes to autism, could be J for jump, because autistic people love to jump. So many of them do. Not all of them. I shouldn't bunch them together like that. But you can see a 40-year-old like on the balcony jumping away when you're talking about somebody with autism. But it's not for J. No. Today is the letter J, but it is for just talk already. I thought about this letter a lot. I had a lot of ideas. And I remember when I was raising my kids, that feeling, that crazy making feeling of seeing a child who can echo everything or say the entire commercial or sing 50 songs, not be able to answer me when I ask a question, not be able to tell me how their day went, or even answer something as simple as what color is that when I point to red and we just talked about red and they said red, or go from talking at the table when they're practicing and working at speech to getting off the table and coming to talk to me and losing everything. And there was this part of me that just wanted to scream, just talk! I might even have done it. But anyway, nobody's perfect. As I came to understand the brain, I learned to understand what was going on, and I want to share that with you because this really can be crazy making. This feeling that your child is withholding in some way. There have been a lot of myths around autism. There was an idea at one point that it was a choice. The whole thing was just a choice, and if we could convince them, they'd pop out of the egg of autism and be normal. Neurotypical is what we would say now. It's not a choice. It's a brain processing problem. So when you understand the brain processing problem, you're emotionally connected to it differently. You won't feel as frustrated, and you'll be more helpful to your child. So I'm just going to point out a few of them. One is that spontaneous language is easier than requested language. If you see the child running around singing their songs over and over again, and they're pronouncing everything perfectly, that... Not like I just said perfect, I said perfect. But they're pronouncing it perfectly. That's spontaneous language. That's language that went in while they were having fun and it echoed into their brain and they're having fun again, and that state is being recreated, and so those words are coming out. But when you ask them to do something, there's a part of them that goes, wait a minute. What are they saying? What do they want from me? They see the expectation on your face. So there's the psychological component, but there's also a physiological reality to processing a request and then giving you language that you've asked for that is very different than a spontaneous desire. So when you see your child able to do something, anything, language in this case, in one arena and not be able to reproduce that in another, it's not because they're trying to trick you or withhold from you. They really do want to talk. I have never met a child with autism or an adult with autism that doesn't want to communicate. And that's the right word, communicate. If a child is apraxic with autism, they can't get the word out, but they are getting the language in. So their understanding, their receptive skills are way up here, but their expressive skills can be all the way at 0. When you work with somebody who has low functioning muscle problems, they often have a muscle problem in reproducing language. There are many descriptors here and many ways I can explain it, but what I can tell you is if you use total communication, if you accept gestures and signs and pictures and typing and facilitation, approximated speech and speech. If you accept all of these things, when the child is able to give them to you, they're communicating. And though I've met many children with autism that don't grow up to be able to talk, I've never met one, never at any age, that isn't communicating. So the first step is for you to listen. And then the second step is to get a real idea about which kind of autistic child am I dealing with. I mentioned apraxic, so I'm going to just hit on that really quickly, and then I'm going to end this little episode because I'm making them too long lately. Okay, so an apraxic child, in fact, I work with one. I'll use an example from his situation. When they first were teaching him language, they taught like this. I'm going to use the word snack. S-n-a-k. So the problem is he's apraxic. And just like when you teach someone to read, sometimes use a phonetic approach and other times use a sight word approach. When someone's apraxic, you don't want to break it down into all those sounds, because what you end up with is snack, and nobody knows what he's saying. And he's frustrated because he's doing exactly what he was taught. So with an apraxic child, you go snack, snack. And you can use prompts. You can use the places that you put your fingers and your thumb and go like this to close lips and go like this to open lips. And you can touch the throat. You can help them in many ways. But what you want to do is give them the whole word, or at least the whole syllable. And you'll be prompting for quite a while, because though they understand what you're saying, they can't bring it out. And it takes a lot of repetition for that. I'm Dr. Lynette Louise, the Brain Broad, and you've been watching the ABCs of Autism. Please like and subscribe.